Just 1 minute ago, shocking reports claim 40,000 paramedics have walked out as 61 emergency zones collapse across the UK.
Ambulance workers across the UK now face what their managers are calling the very real possibility of violence or abuse.
More than 40,000 qualified nurses left NHS employment.
In this video, we break down what's really happening on the front line and what officials aren't saying. In South Manchester, a routine chest pain call spiraled into chaos. Paramedics arrived near a cluster of migrant housing only to find the street packed with residents refusing to move. Access to the patient was blocked, voices raised, and tensions escalated fast. With no clear path through the crowd, crews were forced to stand back while neighbours attempted improvised first aid, a delay logged internally as preventable but unavoidable. In East London, a stabbing response stalled before it even began.
Lots of other calls that are apparently coming in, but we haven't really got any information on patients at the moment.
As ambulance crews approached, bystanders surrounded the vehicle, filming on their phones, shouting abuse and ignoring instructions. Dispatch logs later marked the scene as "scene unsafe", a phrase once reserved for rare flashpoints but now appearing with alarming regularity. The patient waited while medics remained inside the ambulance, unable to step out without police support.
The pressure that's putting upon our staff, we all join to look after folk and we're not. We're waiting to look after folk.
Birmingham crews faced a similar retreat. Responding to reports of an injured man, paramedics found themselves confronted by a hostile crowd convinced the ambulance was helping the wrong side of a local dispute. Threats followed. Objects hit the vehicle. Dispatchers made the call to pull the team back, but to no avail. In Bradford, a mental health emergency turned violent. Paramedics were pelted with bottles and debris as they tried to reach a distressed patient. The crew withdrew, police were requested, and treatment was delayed by nearly an hour. Across reports, the pattern is the same. Rising hostility, shrinking access, and emergency care repeatedly stopped at the curb instead of the doorstep. The operational fallout is brutal. In a single 24-hour window, more than 5,700 life or death calls were rerouted as crews flagged scenes they couldn't safely enter. Response time in affected areas stretched to nearly 3 times official targets, not because ambulances were unavailable, but because access was impossible. 61 response zones were temporarily downgraded after repeated obstructions, many clustered in the same high-pressure neighbourhoods already stretched thin.
We're losing valuable staff because of the pressures they're feeling. We can't deliver the care that we want to deliver as paramedics.
Dispatchers now label routes that were once routine as hostile perimeters. Calls that used to be straight medical responses are treated like security operations, with police escorts requested even on weekday evenings. Every extra step adds minutes. Every minute costs lives. Internal NHS dashboards show a sharp spike in obstructed incidents, nearly triple the long-term average in some regions. What's more alarming is the normalization of it. Crews expect resistance. Dispatchers hesitate before deploying teams. The system adapts by lowering standards instead of restoring control. On the front line, the psychological shift is impossible to ignore. That split second before opening the ambulance door, the calculation of whether a call is worth the risk. Crews report routine verbal abuse, spitting, threats, and crowds closing in, turning medical judgment into survival instinct. Dispatch centers now openly debate whether it's safe to delay care than to send teams into volatile scenes. Behind closed doors, internal briefings paint a darker picture than public statements. Managers warn of compounded degradation, a slow breakdown driven by overcrowding, stretched services, and rising social tension. Yet, ministers continue to frame the crisis as temporary strain, insisting systems are holding. Officially, there is no confirmed mass walkout of 40,000 paramedics, despite viral claims. What is verified is daily abuse, escalating assaults, and a workforce quietly burning out. Northwest Ambulance Service confirms near-daily incidents of violence across 2024 and 2025, with calls for tougher penalties and stronger protection laws still unanswered. The gap between frontline reality and political messaging keeps widening. And in that gap, trust collapses. First among crews, then among the public relying on them to show up. This surge in violence doesn't exist in isolation. It's colliding with a wider NHS staffing crisis that's been building for years. At previous peaks, more than 40,000 nurses left the system annually, pushing attrition rates above 11%. Paramedics now face a different contradiction. New graduates struggle to find placements, while experienced crews walk away, deterred not just by pay or hours, but by fear. In some regions, up to 40% of newly qualified paramedics report unemployment or underemployment, even as emergency cover weakens. Abuse against ambulance staff has reached record levels. On average, crews report more than 60 violent incidents every day, including weapons being pulled, vehicles damaged, and staff physically assaulted. Female medics are disproportionately targeted, accelerating burnout and exit rates. Campaigns like #WorkWithoutFear trend briefly, then fade without structural change. Political debate often circles migration pressures and community tensions, but verified data points to something simpler and more dangerous: overloaded services meeting frayed public order. There's no confirmed nationwide red zone collapse, but the strain is real, measurable, and growing. And once fear becomes part of the job description, retention stops being a policy problem and becomes a safety crisis. The implications are stark. When the people sent to save lives no longer feel safe stepping onto the street, the entire emergency safety net weakens. Patients deteriorate while ambulances wait. Conditions worsen in delays that never make headlines. Over time, the system frays quietly. Officials distance themselves from claims of no-go zones or migrant flashpoints, but insiders describe something more subtle: a collapse of public order disguised as routine disruption. Emergency medicine becomes risk management, not rapid response. If this trajectory continues, trust erodes on both sides. Crews who hesitate to respond, and communities who stop believing help will arrive. The question now isn't whether Britain's emergency services are under strain. It's whether the damage is still reversible. Is the country watching its emergency net unravel, or has it already torn?